The DOH also recently launched the Citizen Participatory Audit of health centers across the country. Ano ba po ang pwedeng maitulong ng ordinaryong mamamayan para po ma-report sa ICI or sa inyo yung mga, ano bang tawag doon, haunted hospitals or health centers?
Yeah. Oo, yung nakita namin sa Marikina, buti inayos na, no? Nagsisimula na silang ayusin, tinawag naming manananggal kasi meron siyang base pero wala siyang taas. Pero ngayon inaayos na nila. Thank you to Marikina. And then, yung iba naman kasi, merong facility, doon nagsimula yung term na haunted. Remember, they're not ghosts because they are there. It's just that walang tao. But anyway, the formal term here is non-operational. There are 300 as of latest count na hindi operational. So we launched this email address. Actually, you can go to our website. Punta ho kayo sa website ng DOH, www.doh.gov.ph/bantay-superhealth. That's one word, Bantay Superhealth. Tapos, you will see the mechanics there. It includes how you can upload a picture. You can take a video or a picture and send it to the email bantaysuperhealth@doh.gov.ph. This will help us very much to speed up validation, even if we already have a list of the 300. But if everyone helps out and this will be submitted to us, mas makukuha kami ng advanced information kung saan yung pwede namin mga bisitahin.
Okay, so ulit na lang, no, medyo naging choppy yung line, Doc. Ilan po yung na-discover niyo? 300? Yeah. Was it 300 centers?
Yeah, I'll give you bigay ko sa iyo yung full numbers, no, para hindi tayo magkano sa counting.
Sige.
Since 2021, there have been 878 super health centers funded by the Health Facility Enhancement Program. That's 878. Out of this 878, there are 365 with ongoing construction, so there's no problem with that kasi ginagawa na sila. There are only 196 that are operational, 17 that are partially operational, and then 300 that are non-operational.
Okay.
Okay, so what led to this? Isn't it that when you plan to build a so-called super health center, meron na ring program to man these centers?
I'm glad you asked that, Tess, because we have preliminary data at that point that if it is the DOH that executes, that implements the Super Health Center assistance, umaandar siya. We actually end up being operational because the planning is bottoms up. Ibig sabihin, local government unit is on board. They actually agree with us as to the site and they are fully committed to putting people. Unfortunately, there are also other super health centers na hindi DOH yung nag-implement. In fact, sometimes it's the LGU, sometimes it's the DPWH. And when that happens, you might be able to build a super health center, pero pagkadating sa singilan, parang ito na yung commitment nyo po, kailan nyo po tatauhan, biglang sasabihin, ay, nag-hire pa kami, or ay, kulang kami sa pang sweldo, etc. Pero meron yung memorandum of agreement.
So ideally, Doc, sino ba dapat yung nag-i-implement nito? I guess better if it's the DOH, no?
Ito kasi yung difficulty siya na meron tayong Local Government Code of 1991, Republic Act 7160, at ang nakalagay doon, ang primary healthcare is the responsibility of the municipality, sometimes up to the barangay, sometimes the city rin. Not even the province, kasi yung province, mga hospitals yan. And then the DOH, dapat mga specialty hospitals. That has been our law since 1991.
Yeah.
But for some reason, and many reasons actually, hindi makapagpatayo yung ating mga local government units. So many valid reasons. So what happened was, around 2021, lumabas na itong Super Health Center program, pero hindi na bago yung batas na ganun. Kaya nagkakaroon tayo ng ganyang confusion.
Okay, so moving forward, are you guys planning to lobby na parang baka ibalik na lang sa DOH, or will that mean na ma-overwork din kayo and ma-overwhelm din kayo sa dami?
Actually, Sean, it's even better. We did not stop at lobbying. We just did. We are doing. This is the bagong urgent care and ambulatory service centers, the PUCAS centers. They essentially are similar in size and capability to super health centers. But you know what, Lesson Sean, what the big difference is? The one who owns the bukas is the Department of Health. Kaya madali namin tauhan, madali namin pondohan. And we have been saying, this is like the moving forward, the 300 non-operational. Sabi ni Secretary Arbosa, kung hindi na kaya ng LGU, hindi na kami maninisi, bahala na yung ibang agencies like the ICI na mag-investigate for any wrongdoing. But insofar as we're concerned, just donate those non-functional centers back to the DOH or use a usufruct, as the lawyers would say, and we will take over and run them like bukas centers, which are running.
So what happened was the devolution of the health services did not catch up with the other laws. Parang ganon.
Correct. Correct, Steph. The resources. So, if you compare education with health, ang education hindi sila na-devolve eh. Ang health na-devolve. So, dyan nag-ugat ang maraming problema since 1991 and counting. And,
hindi maganda yung batas na yan.
To fix it for so many years.
Actually,
yes.
That law did not do good. Sino na nga gumawa ng batas na yan? Anyway.
Pero nabanggit niyo yung use of FROC, i-donate na lang back to the DOH yung 300 na non-operational super health centers. Parang yun ba yung balak nung PCO, di ba? Yung meron silang training center na bakit daw sila yung nagpatayo, nahanap nila sa Bukidnon, ngayon i-donate na lang daw nila sa Bukidnon for school. But how hard would that be? Just to manage her expectations, Dr. Domingo. Mahirap ba yun? Mahabang proseso ba?
Mabilis. Hindi, mabilis lang yan. The story of the first bukas center in Santo Tomas, Pampanga, March 2024 binuksan. The local government of Santo Tomas, Pampanga had this small district hospital na hindi nila mapatakbo. So what they did, they executed the deed of donation. Mabilis ang pirmahan. Kasi nandun nakatayo na siya eh. And in less than 1 month, napaandar siya and it's now seeing around 9,000 patients per month.
Okay, so that would be the benchmark, I guess.
Yeah.
But how would it work also, Doc? Do you guys call them up and say, oy guys, baka gusto nyo i-consider, i-donate na lang sa amin? Or,
yung mga haunted na nga.
Yung mga haunted. Or yun nga, kayo po ba yung nag-reach out? Or do you wait for them to reach out to you guys for the donation?
Well, it works both ways, no? So, one, we do reach out, especially nowadays, no, na there's one of the benefits of this increased attention on the super health centers. More and more LGUs are now looking at these options. And as we always say, as we have demonstrated in the case of Antipolo, nung dumating kami doon, parang medyo nagkahiyaan kasi inamin naman na Antipolo, they opened on the same day. Sabi nila, they've been preparing. Sabi namin, sige na, hindi na kami mag-bubustise, just make it run. So, mandar na siya. So, we're hoping that's going to happen with the 300 minus 2, 298 other super health centers na hindi pa namin physically napupuntahan, but there are already instructions for our regional directors to start para bang not only linking but even visiting, doing oculars doon sa mga super health centers na yun.
But did this not cross the attention, come to the attention of the DOH without this scandal, with this flood control scandal? Parang naging sanga lang siya eh. But apparently, 300, that's not, that's a big number.
Correct. 300 since 2021. Well, I can only speak for the time of Secretary Arbosa from June 2023 onwards. But remember, this has been going on since 2021.
And Sec, nabanggit nyo na pwedeng magsumbong via your email address through the official website of the DOH. Pero meron din bang nagsusumbong doon sa Sumbong sa Pangulo website about this? Kumbaga, kasi for some people, they might think, infra rin naman kasi to.
Yeah, pwede. Actually, pwede rin yun. Pwede rin dumaan sumbong sa Pangulo. So far, wala pa namang nare-refer sa amin, but we'd be glad to take on any referrals if the Office of the President will receive such complaints.